Okay, I'm going to get started just talking with personal stuff, and then I'll give it just a couple more minutes before we start with vaccine stuff. So my family lives all over. And guess who's the point of contact for vaccination information? That's me. So everyone in states all over America are calling me saying, when can I get vaccinated? So every county, I have to look at their website, and it is so confusing. Could we have made it any more confusing? Like literally, it is county by county, state by state, and you have to look it up for each website and read all of it to even have an understanding. And it just helping everyone made me realize, like, we're doing a really good job. So it made me feel even better about everything that our team's putting out, because it's like, oh my word, like that is nuts. Like that is truly so incredibly hard. My mother has a master's degree in education. She's in her late 80s, but I mean, she's been assistant superintendent. She couldn't even figure out what website to go to in Texas, you know, because there was 2 or 3 different ones, and then which form is it? I was like, oh my word, if you can't figure this out, there's no hope for anyone else in Texas. That's all I can say. It's just so difficult. So all of our teams have started contacting people. Have any of you all been contacted by us in some way or another? So that's good to see. So it's all working. So like I said in the last phone call, if you or your loved one is served by our board, we're going to call you or contact you when it's time for the vaccination. And we've made that commitment. That's not happening all over Ohio. I didn't realize that either, but I couldn't imagine not contacting each person and saying, okay, now it's time for your vaccination. So we've made that commitment to contact each person as they are eligible for the vaccination. And then we continue to have families reach out to our helpline or to me directly saying, here's my question, or if there's extra doses, can we go? And so that's all worked out really great too. And we've been able to work a lot of people in to get vaccinations. So Janice, will you tell me when somebody named Emmanuel comes on? Okay. You're on mute, so you have to unmute yourself to tell me. But so I think Zeke's Pharmacy is going to send a pharmacist just to answer if you guys had any remaining questions about the, oh, that's great, Linda. So everyone in the group home got their vaccines. So that's what should be happening now across our county. I escalated for about 2 or 3 weeks that we weren't getting as many in Montgomery as I thought we should be compared to other states. And it's picked up, like we've gotten more. And Director Davis, he's in charge of the state DD system, met with the governor over the weekend, and they got the vaccinations in place so that our phase 1B will come to our boards of DD before they go to anyone else. So we're going to actually start those this coming week. So that's really, really exciting that we're getting all of those vaccines in Montgomery County in our hands. Well, not literally, but they'll be in our possession, and we'll be able to do those vaccines next week. So if you or your loved one is in phase 1A, they should have already been contacted. That means they live in a congregate home with at least one other person with a developmental disability. they should have been contacted because they're eligible. Or 1B is that they have a congenital disorder, developmental disability. It was a list of very specific criteria that makes them eligible, and it's on our website. And then after that, we'll be working on the additional phases of the vaccine. So we are working in people on standby lists as we have vaccine available, but I'm going to stop for a minute and ask if anyone had any questions about who's in 1A and who's in 1B. So 1A are people living in residential homes or ICFs like Stillwater. And a lot of those homes are getting vaccinated or have been vaccinated. Or it can be a parent with 2 children with disabilities. That could count as a congregate setting too. And then the 1B is that very specific list of developmental challenges and congenital disorders. And out of that list, we have about 700 people in Montgomery County that we serve that will meet that criteria as well. And all of those will have received an email, and they'll be getting a letter in the next few days, and then we're calling them all. So I think out of those 700, we only have about 50 more to call. So they've been calling since Tuesday to make sure everybody's.
I'm sorry to interrupt. I just found out from my SSA, I have not received any information about my son, and he has both cerebral palsy plus the congenital developmental disabilities. His SSA put him in as a 1B, and I've had friends that have been contacted, and I know you have so much that you guys are doing, and it's been wonderful what you've been doing. But he checked with his supervisor, and my son was not on the list, and he had put him on the list.
That's interesting. Well, I'm glad you called, and thank you for letting me know, because the state will ask us how reliable was that list. And that list of 1B came from the Ohio Department of Health and through DODD. And then we went through it once, but we literally had maybe a couple of hours to go through it before we had to start calling. It's all happening so quickly. So I'm really glad, Marla, that you reached out, because we realized that there could be people. So once we make all the calls by tomorrow, we're going to start going through that list more and checking. So that's really good, Marlon. Is he signed up to get the vaccine now?
Jay Neiman told Doug that I needed to call the number, and I just called the number before I got on. So hopefully they'll be giving me a call. Yes.
So we have all those vaccines coming to Montgomery County. So that's really, really exciting. And while I'm thinking of it, I want to thank Mitch Snyder. He's our Director of Provider Relations, and literally he's doing everything else. You don't want Mitch's job if you ever apply for a job at our board. He's done the Pandemic Resource Center. He's managed all the meals that have been delivered, and now he's managing the clinics. I'm sorry I'm laughing. It's just an incredible amount of information, of things to manage on top of your day job.
No, it's been great. I have a great team helping me. So that's good. I've got all hands on deck. It's going really well. So you should get a call in the morning. If you called the hotline today, right before this, we start pulling calls off that at 7:30 in the morning, and we start contacting people.
Okay, thank you.
You're welcome.
That's great. Thank you, Marlon. Thank you, Mitch. So that's exactly how we're doing it. And we're literally doing it kind of person by person. I think I'm still getting about 10 calls a day where people have gotten my number and they have a question or they want to make an appointment. And then we now have a hotline number that Mitch's team gets the names off of, and he gets them all lined up. So it's really just an ongoing process. And this, I think, will be going on for a couple of more months. Just the rate that the vaccines are coming in, and then we'll have the second doses. So, you know, we're going to keep doing this. So if you haven't been to the clinic yet, it's at Mount Enon Missionary Baptist Church in downtown Dayton. And we're so grateful for the church just offering their beautiful space. And then we have a lot of our leadership team there helping to organize and get people to the right place. And then Zeke's Family Pharmacy is the pharmacist who's partnering with us and our Board of Health to give the vaccinations. And I've heard that they're just really, really nice. So, and that they'll answer questions and they're very friendly. And I've heard really good reports from those that have gone down to the church. Despina, not to put you on the spot, but how did it go for you guys?
First of all, I thank you all that you work on that. Mitch and the crew down there, they were excellent. We did not have to wait. They were very polite, welcoming. The paperwork was done in minutes, so everything was fine. The only question that I have for the second dose, they gave a date, but they did not give a time. So I'm asking if we need to have an appointment for that or we walk in.
We'll be figuring that out. You're about 10 steps ahead of us, but it will be at the same place. And we have gotten confirmation that we will have those doses. So we'll let you know. We'll figure out times because we don't want anybody to have to wait. You know, so we'll space everybody out during the day. So you'll be getting a call. I'm sure that's how we'll do it for the second doses.
But thank you very much. It was very, Mitch gave me his card. I share it with some other families. So that was very nice.
Great. Great. Well, somebody today said we were organized as good as a Chick-fil-A, which is the highest compliment. We're like the vaccination Chick-fil-A. So that made me feel really good. So it's good. We've never done this before as a system. We've never been doing vaccinations and running a clinic and figuring out efficacy and, you know, and talking about medical things like this before. So it's been a learning curve and I appreciate your patience, but it feels like it's going really good. So we're going to be getting vaccinations and we only get the vaccinations like a day. Like we don't even know too far out. We do know next week we'll be getting all the vaccinations we need for group 1B. So we will be getting those. But like for the clinic tomorrow, we only found out yesterday how many we would have. Isn't that nuts? And like that's the whole county, like they don't know. They literally just know a couple of days ahead of time how many they're going to have. So it makes it all just a little bit more challenging. And we don't want to have any doses sitting, and we have committed not to throw any doses away. I don't know if you guys have heard about that on the news about, you know, not throwing doses away. But what's real interesting with this vaccine, I might have shared this last time, is it comes in a vial, a glass jar, and each glass jar has about 10 doses, but some glass jars have more. And you don't know until they start pulling it out. So one day, I think the last clinic, they pulled out 11 jars. And so each jar has 10 doses. So that should have had 110 doses, correct? So 11 jars. Guess how many we had? 121 doses. We had an extra, what is that, 11 doses. So Mitch was calling me, we were calling people going, oh my goodness, because you have a very short period of time to get people there to take those. But it's just really a challenge in how kind of they're packaged and then the timing around it and everything. But so far, it's just all gone really, really, really great. So before I go on to the next thing, I just wanted to see if anyone had any questions about getting the vaccination. We are giving leftover doses, kind of those extra doses to staff who might work for providers who don't otherwise qualify. Well, we're also giving them now to parents who might meet that 1B age limit. So like if you were going to qualify as a senior adult and you bring your child to a clinic, we would try to give you an extra dose. Okay, so you wouldn't have to go to a different place to get your vaccination. We're not putting that on our website, but I just want you all to know that that's what we're trying to do. Just
I have
because.
a question. This is Danya. If my son is eligible under the 1B and he goes tomorrow, but he does not live in a facility, he lives at home. As the caregiver, are we able to get that or no?
You're not supposed to right now under 1B. Will you qualify as someone 65 and older?
No.
Okay, so you would not qualify, but what Mitch will do, or the people at the clinic, is they will take your name, and if we have extra doses, then they will let you get it.
Okay.
And
Thanks.
once again, sometimes we know we're getting a couple of extra vials, so we kind of know ahead of time, but other times it's literally as they're drawing them out of the jars, and we're like, oh, we're getting 2 extra doses out of every jar.
Okay.
Okay, good. So I've asked them to try to vaccinate everyone who wants a vaccine. I would rather have them in arms than not in arms, but we definitely want to make sure everyone with developmental disabilities gets one, that wants one as soon as possible.
Thank you.
Mm-hmm. Now, do any of you all have somebody who's not in 1A or 1B who's waiting on a vaccination? Okay. Carolyn, you do? So if you would like to get them on a waiting list, you can, Mitch Snyder, oh wait, he's putting it on. My staff is now starting to read my mind before I say it. So
absolutely.
he just put in the chat box the phone number and the email. So you could email them and say, my child or the person I'm guardian for is not in 1A or 1B, but I would like them on a wait list. And then they will let you know as soon as we have additional vaccines available. And it could be as early as next week.
Can I ask a question?
Yes.
So in the age of robocalls and scams, is there a certain number that we can expect the standby list to call from?
No, it could be any of us. There's about 50 people making calls all the time.
Good enough.
So what we've been doing, because I understand that we leave our phone number. A lot of times it's my phone number. So we leave a phone number to call us back, but we will leave a message, okay?
Okay, that's good. Thank you.
Yes, Art?
Question, of these calls do you know how many people are wanting to accept the vaccine? Is it like 50% or higher, or?
We were trying to kind of get an estimate, and right now a lot of our calls go to messages, but out of the first like 500 to 600 that we called, that we did follow up with, I would say it's around 60 to 70% probably are accepting it. During the calls, it's about 50%, but then we get so many people calling back once they hear the message and what we're calling about. So maybe by the next parent meeting, we'll have like a real statistic. My feel is it's 65%. That's going to be my guess, Art, is 65%. So a lot of people do say they want to check with their doctor. Maybe they haven't checked with a doctor yet. But a lot, as soon as we call, are like, yes, sign us up. Very few people will say no, no way. But we do get a few of those. Like I made maybe 100 calls the other night and 2 people said no, no way out of all of those. So that was hopeful, you know. And then a lot of people were really grateful, and a lot of people just wanted to talk to a doctor or then called me back later.
Thank you.
Yes, Despina.
I like to say first that it is very nice that you have the clinic and the environment is very familiar and the people to our kids, so the stress level is not low. And I do appreciate that. It was very nice. The other thing is about the staff. Misinformation goes around. I know staff that they do not consider getting vaccination. How can you improve this kind of turnout of this population, not our kids, but their staff?
So right now with our staff, we have the highest staff rate in the state of people getting the vaccination. So I was really excited about that today. So I was on the call and realized that the number of staff in Montgomery County getting vaccinated is higher than anywhere else in Ohio. And I think one reason is because it's in the church, it's in a friendly place. You know, we have staff there. It's really easy to go get vaccinated for the staff who are working in these congregate settings. Plus, we did offer a $400 incentive to staff who get the second vaccination. And the providers have said that staff who didn't know whether or not they would get it, that kind of pushed them to getting it. So when we first started thinking about vaccinations back in December, some providers asked their staff how many are going to get it. And it was only about 20 to 25% of staff said they would get the vaccination. And that's kind of the same numbers across the state of Ohio. So we started trying to think of things that we could do to get people vaccinated, who work with your kids, who work in the congregate settings. So that's how we kind of came up with like the good location, making it real easy, and then also the incentive. So the providers have said that the incentive has helped significantly. Like a lot of staff who didn't know if they would get it, the $400 just completely changed their mind and they are going to get it now. We've also had staff who have taken people to the church to get vaccinated, and the staff weren't going to get vaccinated, but once they got there, they were like, wow, this is really nice. The pharmacists are nice, and they get vaccinated. So just that whole atmosphere. So we just had our first large provider. Guess what percentage they had vaccinated? 70%. Yay! That was like a goal for June. Like, and nobody else had that goal. Like, that's an amazing goal. So our first large provider has come back at 70%. The other large providers, the residential providers, they don't have a way to count yet, but they said they strongly feel like they're somewhere between 55 and 65, and it's growing. And they said the part of their staff are ready to get their second dose. And as soon as those people get the $400 from us, they said they feel like most of the rest will go get it because that's a lot of money. So we're so excited to see that it's having that strong of an impact. So our goal is to have 70 to 75% of our system vaccinated by June. I really didn't know if we would even come close to that, but it's really, we're in January and we could hit 60% overall with all of our providers before the end of the month. And that's amazing. So I was very excited. The providers are doing a great job educating. We're going to do, Dr. Komorowski and the pharmacists have agreed to like kind of do an information sharing with DSP. So we're going to do that in a couple weeks when things slow down a little bit. But we're getting a lot of momentum with the incentives and things like that. So I'm really appreciative to our board and the county for letting us do that, because they jumped on board with it, you know, even whenever it was kind of a really new idea. So we're excited about that. Yes, you're on mute.
Now I can talk. Okay.
Yes.
If we're supposed to go back in 4 weeks to get the second dose of our vaccine, and they just tell you a date, but they're not telling you a time, will somebody give us a time or you just show up?
We will figure out a time and we will let you know.
Okay.
Because it will have to be scheduled, because we don't want people to congregate or to have like a big mass at one time. So we will be following up on those second doses and making sure everybody knows to be there in a time frame.
Okay, thank you.
Uh-huh.
Has
Questions?
oh, I'm sorry.
Uh-huh.
My son they're doing the Pfizer tomorrow. Has anyone had any reactions to either?
I've not heard of any reports from our clinic. Have you, Mitch?
No, we've had absolutely no problems at all. We vaccinated like 815 people and we've had nobody with any significant side effects at all. Most of it's just a sore arm, just like you get with a flu shot.
Okay.
But we do keep
either,
2 nurses. We do keep
or
2
either the
nurses at
Pfizer nor the
clinic.
Moderna?
I'm
Right.
sorry?
Yes, from
Okay.
either.
Okay.
Pamela, we have had 0 MUIs filed for allergic reactions.
That's
Okay.
good to know too, Bill. Good. Good
'Cause
questions.
I know when I told my son yesterday today that he's going tomorrow, and he's excited, but he said, what about, what about you? So that's why I was wondering about the caregiver, just so he won't be afraid.
Yeah, that makes sense. So talk to them, you can talk to them whenever you're there and even ask them if there's doses available.
Okay, thank you.
Mm-hmm.
So we have a question in the chat that reads, has there been any classification for single caregivers of MCB DDS clients to receive vaccines?
No, we've not received any classification from the governor's office yet that I'm aware of. So the person who wrote that, if you would like to be on a wait list, that's the information that Mitch put onto the chat a little bit ago. And you can email that and say, I'm a single caregiver. I care for one person with developmental disabilities. Put me on your wait list.
And then we had another chat. We may have touched on this already, but which shot are we receiving? And we've said we don't know from day to day what it will be. Tomorrow's dose will be Pfizer, Mitch?
Correct. Today or tomorrow and next week as well, is my understanding, we'll have Pfizer. But we don't know beyond that.
Yeah, all next week is Pfizer. So the state of Ohio decided Pfizer for 1B. I don't know why, but that's just what we got word of. So, and then we are also working, the state worked out a partnership with Dayton Children's Hospital. So we are able to offer vaccinations there as well. They'll be doing those next week. We're not sure yet which day, but those will be through us as well, but they'll be at Dayton Children's for people of any age. So not just I mean, children don't get vaccinated, but adults will be able to go there and get vaccinated. So that's a nice option to have as well. So any other questions around vaccinations or processes?
Have you given any second doses yet?
No,
No.
no, we have not.
Yeah, that's February 5th are the first, second doses. I mean, the reports are that people have more side effects with that second dose. Like more achy and things like that. You know, I haven't heard of anything too significant, but that it can make you feel worse. And so I see the chat. If you want to go to Dayton's Children's, Mitch, it will help me if they still call the helpline or email you, and you all gather that information for Dayton's Children's. And then tomorrow I meet with Dayton Children's and they'll tell me what day the clinic is next week.
Yes, great. Yeah, the hotline, if you call the hotline, we've got 5 different people to check it. We check it nearly every hour unless somebody's out. And then at the most, your message is on there 2 hours. We pull it off and we start calling people back. The help goes to 3 of us. And we parcel it out, and like if I'm getting overwhelmed, I've got 3 other people I forward things on to. So you should expect pretty quick results from either of those. And if not, you can always email me directly.
Thank you, Mitch.
Uh-huh.
Yeah, so it's all going very well. And next week with the 1,160 doses that we're getting for phase 1B, we should be able to work through a lot of people. So those in 1B, and then even other people who might want to be vaccinated. So if you know of somebody who doesn't qualify for 1B, but might like to get vaccinated later in the week, if we have doses remaining, let us know. Well, let Mitch know. And he'll keep track of that for us. So it's going very, 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 very well. Feel very good about it. Any other questions around that? It's amazing what a difference 2 weeks can make. So one thing I would like to ask you guys to do is if you can send me either a thank you email, like even like one sentence that I can send to the governor or our director, Jeff Davis, or our county commissioners. I want to somehow put together a little thank you from Montgomery County, because they did a lot to put folks with DD in the front of the line for these vaccinations. Literally, they were moved to the front of the line. And Jeff Davis, our director, was in the meeting when the governor was discussing this. And there's all these other groups like elderly, the veterans. And he said nobody argued with our folks going first. Isn't that wonderful? It just makes you love Ohio. Like nobody argued. They're like, yes, DD goes first. And everybody's arguing about everything right now in these meetings. And he's like, it was the first time that everybody was like, yes, yes, let them go before us. And I just want to send a thank you to somebody and everybody, you know, from us. So even it could be a picture of somebody who got vaccinated, or a thank you, or you could write thank you, write a thank you card. I don't care. We'll put it together in something super creative. And we'll send on to everyone and say, Montgomery County loves you all. Thank you for remembering the folks we serve. So if you can help me do that, and just email it to me. Janice, will you put my email in there again? You know, any kind of a thank you, even just a few words or anything like that. It just made me so proud to be an Ohioan and to have people in a room making decisions like that. It happened over the weekend. We got a call Saturday morning asking if we could get ready to give all the shots next week, if they were able to make it work. And then we met on Sunday, and then we had a Zoom call on Martin Luther King Day. It happened so fast. And it was really, really great that everybody made that work out. We also got a call last week from our county leadership, and they agreed without us even asking to give us $500,000 towards our COVID relief efforts. So we're just so appreciative. And that will go into keeping our PPE and the meals and other supports, that go directly to the people we serve. And that was just so kind of them to allocate $500,000 towards us. Like, that was very unexpected and very welcomed. So that was really great news. So any questions from anybody?
Are you going to mix the second dose if you receive Pfizer or Moderna? For those that they received Moderna, they are going to receive the second Moderna.
It will be the same.
The same. Okay. And my other question, do we have numbers of what our county did last month with the COVID?
How many people?
Yes, infections or losses?
Yes, so the county as a whole had 12,800. That was for all populations, just not DD. So it was a lot of people. Like in August, we had like 2,400. And then in December, we had over 12,000 people with COVID in Montgomery County. Bill, can you share our system numbers?
Yeah, as of this morning, we are sitting at 177 individuals that have tested positive. Of that number, 56 have required hospitalizations, and we've had 11 individuals that have passed away due to medical complications.
And that's since the beginning of the pandemic.
Yes.
So since March.
November was our worst month.
November was the worst month. And even though those we serve are more vulnerable, our infection rate is a little lower than the general population. And I'd like to think that's because you guys are being so careful and all the PPE and just the provider support. So we're really grateful for that our rate of infection is less than the general population.
Correct.
Like, that's amazing. So any questions around any of that? I did want to mention, I mentioned the $400 that we're giving to DSP. So we're not using any levy dollars for that. All of that is coming from the federal government for COVID relief. So our county, that's how we're using our COVID relief dollars, is by giving it to DSPs so they'll get vaccinated. I feel like that's our greatest and most certain path to an actual recovery, is to getting people vaccinated as quickly as possible. So that's how we're going to spend that money.
Am I on? Can you hear
Yes.
me? Okay. If you go for the second dose and maybe they don't know exactly how many doses are in those bottles and they run out when you get there, what happens if you didn't get it exactly 4 weeks later?
So that doesn't matter as much as it sounds like. So whenever they do the calendar, they can kind of, there's some leeway there, but there will be a dose for the person who got a dose.
Okay.
So in that case, those extra doses will go to people who haven't gotten the shot yet. So we'll have people on standby. We won't count on extra doses in order to give the second shot. There'll be enough shots there for the second shot.
The first and second dose are exactly the same?
Yes.
Okay, thank you.
It's a lot of coordination. That's all I can say. I'll share this story. It was very meaningful to me. Kamar told me about one of the phone calls this week, and it was to a senior adult mom who her child is bedridden, and she had been trying to figure out how to get vaccinated, where to go, and calling places, and she couldn't figure it out. And then we called to say, hey, you're eligible. Your child is eligible. And Kamar said she just started crying. Like, she was so grateful to get the phone call, and that we were watching out, you know, even though the media, and it's just so scary and so tense. But then she didn't have a way to get her child to the church because they truly are bedridden. And so guess what we're going to do? We're going to take the vaccine to the house. And in order to do that, because how many shots are in a vial? 10. So if we do the mom and the son, we'll have to have 8 to 10 people standing in their driveway to be vaccinated in the driveway. And I've already had staff say that they'll sign up for the driveway just so that that mom can get her child vaccinated and not have to worry about that. And it made me so proud of our staff that they were like, I'll stand in the driveway. They're going to make it like a tailgate, I think. I don't know. That's what I heard. But they're like, we'll sit in the driveway. We'll do that, you know. And I'm just so proud of our staff. Montgomery County, it didn't even take a second to get people to volunteer to do that. It made me very, very proud. So we're figuring it out for everyone. It seems like every case is a little different, but we're figuring it out. So we're working on it. Literally, this is, I think, all I'm doing right now. Maybe there's 5 minutes a day that I'm doing something else. But I know it's all Janice and Mitch, and, you know, it's like there's no time, you know, and we're just really committed and focusing on the vaccination efforts right now.
One quick thing, Pamela, that we need to mention is that if you know someone who has had COVID in the last 90 days, they cannot get the vaccine. We did not know that until just a couple of days ago. So we're trying to spread the word. It will be in the next newsletter. It is on our website. But if you can share that information with people you know, that would be very helpful.
They have to wait 90 days from their positive test. So that's what the guidance is. The reason is because they're immune from having COVID. So.
New information.
The
new information is that it's 2 weeks after your last symptoms.
Okay.
The CDC has changed those guidelines recently, like this past week.
Oh my word, Dr. Komorowski.
Sorry.
Will nothing stay the same? I learned something really smart and then it changes.
I'm sorry.
So 2 weeks from the last symptoms.
Yep, we have firsthand experience with that as well. I'm glad you spoke up.
Okay, great.
Outside of our family.
Yeah, outside of our family.
Very interesting. Okay, well, that's good to know, because we did have like one person wait in line to get their vaccination, and then the pharmacist at our church said, no, you can't get it. And we hadn't been told that, and we're running the clinics. So.
It's hard to update everyone constantly, but somebody in my office had it, and that's where we checked into it and found out that, yeah, it's 14 days from the last symptoms.
It literally is like building a car while you're driving down the interstate. You know, it is, and you don't know that feeling until you're doing it. And you're like, it's going to be okay. Come on. So, but we're really grateful. Mitch, what is our number total vaccinated now? I know it's like 800 and some that we've done at our clinic.
815.
So isn't that great? So that's like 3 or 4 clinics, 815, yay. And next week we'll have 1,100 vaccinations to give. The pharmacists feel like they can do 50 an hour. So woohoo! They'll be going, and then we're doing more tomorrow. as well. So by the end of next week, I mean, we should be over 2,000 vaccinated in our system. So that's very exciting. So that's real. And then a lot of our DSPs are getting vaccinated down at the convention center, and it will be great once we know those numbers. That's probably another 500, in our system that have been vaccinated down at the convention center. So it's all just really great news. Really, really good news. And we're getting those second clinics kind of on our calendar. So that's good news too, that everybody knows we need those and they have the doses and they're getting them all planned out. So
Pam, I have a question. With the DSPs, I'm an independent provider for my son, and I'm going to tell my age. I'm over 65. So will I be able to get the vaccine at the same time that my son gets it?
Hopefully you will be able to. So are you you're not going, you just called the hotline. So you should call the hotline again and say, I just called the hotline and I'm over 65 and I would like to be on your wait list.
Okay. Okay. Can I tell them that when I talk to them tomorrow when they call?
Yes.
Okay.
Yes.
Thank you.
Good point, Marla. Yes. Yes. So that's good.
Well, as I said before, you guys are doing an awesome job.
Oh,
We really appreciate it.
thank you. Thank you. It feels really good. I always love my job, but it just feels even more meaningful right now just because this is so scary.
Mm-hmm.
It's so scary and it feels good. One of my staff wrote me an email and said it's still so scary, but it feels like you can see a light at the end of the tunnel real far off. But it's just hope.
Yes, it is.
And it feels really great. We have so many staff volunteering to work at the clinic too, and they still have all the other jobs to do, but it's just amazing. They just love being there and seeing everybody and just helping to make sure it all runs smoothly. So any other questions? I didn't see the pharmacist come on. He must be off doing pharmacist stuff. But if you ever have a question about that, you can send it to Mitch to the hotline and we'll ask the pharmacist, and then we'll be doing kind of an question and answer session with our DSPs, like I said, the next week or so. And we could invite parents too, if parents had any questions about it. So I wasn't going to talk about anything else tonight except for the vaccine. We'll save other stuff for another time. This is also overwhelming. Janice, did we have any other chat questions or any other topics? I said, don't forget this.
Nope. We're doing these every 2 weeks. So.
Yeah, because stuff changes every minute. So yeah, we can't go more than 2 weeks. We're still doing all the Zooms. Our staff will still be teleworking for as long as we need to. I have no idea what that looks like. Most of you know that Ritchie Center, we sold it. So our administrative offices are at the Annex, which used to be an emergency housing place in between Northview and Stillwater on North Main. I hope you all know, it looks like a big house or something. It's in between Stillwater and Northview. And it used to be, was it emergency respite housing or something like that? Okay. So that's where I'll be whenever we go back to the building again. That will be where you can find me. Oh, you're welcome, Wanda. So, good. So we're just all staying safe and doing everything. We'll be providing PPE, meals, anything like that that you need. You just, let us know. We'll be continuing that until we're through the pandemic. So, whenever that is. So we'll just keep doing all those kind of things. Mitch, did you have anything to add, or Bill?
No, just the resource center is still open and it's going to continue to be open. I get questions about that from time to time. Even with running these vaccine clinics, we have a team of people still running that resource center. So if you need stuff, let us know.
I have nothing.
Mitch, it's like you have an army going.
I'm telling you, we got a ton of people that pitched in, and I have a lot of people, SSAs, SSA supervisors, our rec staff. Everybody is stepping up and lending a hand to get through all this. So it's been awesome.
Yeah. Yeah. And Bill just did a video on why he got vaccinated. I think that was in our parent newsletter, right?
Was.
So if you haven't watched it, you should watch it. Some people don't need persuaded, but some people do need persuaded to get the vaccination. So even if it's somebody outside of our system, it's a very good message.
And if you have received the vaccination and you want to do a video, I would love to have that. Or if you want to send a photograph of yourself and explain, you know, here's my why, this is why I'm doing it, and just shoot me an email or call me, I'll take that. And we'd love to share it on our website, on our Facebook page. We would appreciate
because that will help our DSPs and people get vaccinated faster.
Yep.
Than me saying you have to get vaccinated. It's a beautiful picture from you and a personal story. That will sell the message. You know, everyone needs to understand, here's why we need you to do this. If everybody would listen to me, this wouldn't take that long, but not everybody does. So, yeah. So yeah, if you can share a video, a picture, a message, anything about here's why it's important to me, that goes a long way. Remember to send me a thank you for the governor and Director Davis. That will make them so happy. They're only getting a lot of complaints, I think. So I think a thank you will make them happy.
Do you like it in a form of email or a card, a hard
An
copy?
email. If you do a card, take a picture of it.
All right.
And email it to me. Because sometimes it's cute, like to draw something or write. We'll just piece it together into this beautiful collage that I have no idea what it will look like, but it will be great.
Of course. It's our responsibility. We were really blessed that we got vaccinated through our kids. It's amazing. Yeah.
That's right. That's right. It really is. And we're so glad that we're able to get these out. And just that the local health department has worked with us so well and allowed us to do these clinics. We can only do the clinic at the church because the health department said, okay. And Zeke's agreed to be there and to provide pharmacists. That's what's made it all possible. And it's really, really nice that we're able to do all of that and get everybody vaccinated. All right. Well, thank you guys. Let me know of any questions. You can email me. It sounds like Mitch is coordinating everything, so email Mitch.
And, yeah, absolutely. Keep in touch. If you have questions, email me.
That's right. Thank you, Janice. Janice will keep you updated, and Bill will keep you safe. So, and then we'll see you in 2 weeks.
And if you want to sign up for the next meeting or any of the successive meetings, it's on our website. I put the link over here in the chat.
Great.
But if you go to our homepage, it's under the news updates. That's where you can find the registration links.
Great. Thank you, Janice. Thank you, guys. Bye. Happy New Year.
Yeah.
Thank
Bye-bye.
you. Bye.
Bye. Have a good night.
You
too.
too. Thank you so much.
Oh, it's Thursday. I had to think about what day is it. Bye. Bye. It's so good to see everybody. Bye.